It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is the dental experience. And joining me is Dr. Lee Sheldon. Morning, Dr. Sheldon.
Good morning, Joe. Good to see you.
You know, when you have a real long-time friend on the show, and you know there's a doctor, and you want to say, Dr. Sheldon, and you know, it's hard for me to say Dr. Sheldon when it's Lee.
Come on, it's Lee. It's okay.
That's all right. Just for your experience of he is a doctor and he is a dentist, and he's a very good one too.
Thank you.
And it's always a pleasure for me to have Dr. Sheldon on the shows with me, because we can, Lee, we can talk about an experience, but you've sort of practiced on me too, so I know what kind of a dentist you are, and in all the over 400 television shows I've done over the years, you form a relationship with certain people you have as panelists on a show. Yeah. And I've always enjoyed doing a show. I have a script, folks. I do have questions, and I'm going to look at my script today because I want to cover all these things with Dr. Sheldon, because it's extremely important. Because the dental experience, I think, Lee, is something that more people to know about, because we've come a long way in the practice of dentistry.
Oh, we have. There's been such a difference from what occurred when I was 5 or 6 or 7 years old in the 1950s, where the dentist might say to you, well, if you want local anesthetic, it'll cost $5 extra, to where we are now. What a tremendous difference. And of course, people are living sometimes through their past dental experiences, and it's kind of difficult for them to understand that the dental experience now is totally different from what it was then.
And what has resulted in is we have diseases related to the mouth that failure to treat teeth is often manifests itself in another part of the body. And that's what most people don't understand that.
A new one, in fact, just research that came out this week talks, and it's the second study we've seen, talks about the relationship between the bacteria in dental disease, particularly periodontal disease, and Alzheimer's disease. And that if periodontal control is not there, then that person is more likely to suffer from dementia. So these relationships between the mouth and the rest of the body, I mean, now we've got asthma, we've got Alzheimer's, we've got diabetes, we've got heart disease, a few others
and headaches.
And headaches? Oh, when we're talking about TMJ and that type of thing.
I'm talking about the TMJ and the muscles. We create so much stress in our body without knowing it.
Oh, it's true. I mean, whether we're talking about psychological stress or mental stress, or whether we're talking about physical stress. And by the way, a lot of the stresses, and it has nothing to do with this, I know, but we never totally stay on the script. But we often ascribe mental things to what could be physical things, and the physical things work on you so much that they become mental things. And all we have to do is make sure we go back to the physical and find out what's physically wrong. And some of the things that we ascribe to mental problems may in fact go away, and we could be taking far fewer medications as a result.
And as I watch you and listen to you and watch you move your hands, I'm thinking about, I have a tendency to want to clench my teeth, and I know that puts stress here. And I know I have to sit up straight.
So do I.
I have to sit up straight, so I take the pressure off my lower back. There's so many darn things as you age, and that's one of the reasons that we have this show, Helping Seniors. Seniors need to have a better understanding of what the entire body picture is.
Oh, it's true. And because we're seniors, people often ask me, is this because I'm older? And the answer is, No, except for the fact that your bad habits or bad things have had a longer period of time to work on you, and so you end up with whatever it is, the problem that you have. Of course, when it's a dental problem, if you have periodontal disease, and the periodontal disease began in your 30s, but what really wasn't addressed until you were in your 60s, then in fact, yes, there's going to be more damage that occurs because it's had 30 years to do that damage.
Well, this is in a show. It was talking about the dental experience.
Yeah.
And we have this old fear factor, and we have the fear of the unknown. And I think that you mentioned when you were 5 in the 50s, and when I was 5 in the 30s, I think what it was when I went into the dentist and they did a little drilling and then they did a little leverage and I felt something crack and break and they went back and drilled some more and they had a drill. I could see the wires and everything. It didn't seem to me like it was high speed like they have today.
No, the high speed wasn't developed until the late 50s, and so no, you wouldn't have had that to begin with.
Yeah.
You would have had the thing that rattles your head a little bit.
Exactly right. So then when I went into the military, and I had extremely good dental care in the military, but many times it was mass production.
It was, and of course I was in the military as well. It was often called the amalgam line. That's what we would call it. Amalgam line means, all right, you're lined up, and amalgam is the filling material that has metals and mercury within it. And the amalgam line is, okay, you're in the amalgam line, that means you're there for fillings. If you're there for specialty work, crowns or something like that, then you'd be going into a different place. Now that got better and better during your career as a matter of fact.
Yes, it did.
But at the beginning, it was not that way. I was both at a large duty station. I was at Fort Sill, Oklahoma, where we had.
There.
Were you?
Yeah.
Yeah. So we didn't have amalgam lines anymore, but still there was the production line, and then there was the specialty line, if you will, and it was a little bit different from one side to the other. Then I was at the Army War College, and then it was just like private practice. It was really neat.
I was on a submarine tender in the 70s. And a submarine tender, by the way, folks, a submarine tender takes care of submarines, and most of the submarine tenders are pretty good and pretty capable. Everything from foundries to pattern makers to carpenters to hydraulic expert to rewind motors, cut pressure holes on nuclear submarines, can do everything. But we had 3 dentists. And one of my dentists was a guy named Jim Fierstead. And Jim was extremely well known because he was an expert in bone reconstruction from wounds suffered in Vietnam.
Important skill. That's an important skill.
Yes.
Yep.
But it was a dentist doing this.
Yeah.
And I had him as one of my 3 dentists working on my sailors on the ship. We had 1,100 sailors on the ship. We worked on the cruise of the submarine. And then we also tried to help our families on the weekend when the dentist came in and gave free time and worked on the patients, the families of our sailors.
Yeah, and look what's happened as a result. Certainly, I mean, bone grafting is common now in the dental experience.
Right.
I mean, we're all doing bone grafting, at least those of us who are surgeons do. Understand that some of these experiences that occurred early on were distilled, were improved, so that more people could take advantage of those of that kind of service in order to be able to have teeth that functioned a lot better.
Not all good things occurred on the moon or in space.
Yeah.
We had some brilliant research going on the ground floor here on good old Earth.
No question. No question. Yeah. And so when I went to dental school, Dr. Robert Shira, who's former Major General of the Dental Corps, was our dean. And he was an oral surgeon and had done a tremendous amount of research. But understand, when you're doing the initial research, whenever you're doing something new, you know what needs to be done. You develop new techniques to make it better, faster, and often cheaper, and then finally you can distill it out into the community. But the original research was done, a lot of it was done in the military.
But what's happened with all this happening in a dental experience as the years have come along, Lee, more people have become less afraid of going to a dentist, and by losing that fear, they're going in and, well, we like to think everybody has perfect teeth. Not everybody has perfect teeth.
If they did, I wouldn't have much of a practice, would I?
That's right.
Yeah. Well, I understand. Let's look at that dental experience, because a patient, and I'll talk about my experiences, although these experiences can be extrapolated to any dentist around here in Brevard County.
I understand.
But understand that when patients are seeing us, obviously they're in big trouble. I don't see patients, I do see patients for regular cleanings and things like that.
But people don't know what you do.
Yeah.
Why, when you say people, tell the viewers what kind of dental practice you do so they understand what you're talking about.
Okay, so I was trained as a periodontist. That's a gum specialist, and part of gum specialist is to make sure that gum diseases are under control so your teeth don't get loose and fall out. And the other part of it, or another part of it from a surgical experience, is placement of dental implants for those teeth that are lost. But the most important part of it, Joe, is something that we don't talk about very much. And that most important part of it is the thought process that goes on, the treatment planning that needs to be done in order to take a patient who's severely diseased, who's missing a lot of teeth, whose teeth don't look very good, whose teeth are loose, and move them to a point where they're looking and functioning like all of us do. There's a certain amount of complexity that's necessary, or a certain amount of complexity in that disease, and then the simplicity is treatment planning. It's saying, all right, step 1, we do this. Step 2, we do this. Up to step 15 or step 20, and we're all done. And that's what treatment planning is all about. That's a big part of what a periodontist does.
And for people to think that doesn't happen, it does happen. I had a recent experience where I talked to a man, 54, and he has severe periodontal disease, and his teeth are coming out, and they pulled one tooth, and the one behind it started just to fall out. So last week, or a week ago, from the time I talked to him, he had 4 more taken out.
Yeah.
With the new healthcare insurance, it doesn't cover the dental.
It doesn't, but understand the diagnosis. You hear early diagnosis, early cure. The same thing is present for periodontal disease. The diagnostic materials and the diagnostic techniques that we have available to us now are so much different from what we had even 10 years ago. Example, I can have a patient spit in a cup and identify which of the 11 periodontal bacteria are in the mouth, and I can help that patient with an antibiotic and non-surgical periodontal care. And for many people, their loose teeth can become tight. I mean, obviously, there has to be that healing potential. But that's far different from the days where we had to extract more teeth and where we were doing gum surgery in order to be able to accomplish the same result.
See, this is something we don't talk about.
No, we don't.
One of the things here, I said, when we're talking about injections, most people have a tremendous fear of injections. And I remember I told you one time about the dentist I had on the Elwise Pier that decided he wanted to fill one of his own teeth. So he was looking in a mirror to give himself an injection above this tooth. And he told me later, he says, Joe, he said, the closer the needle got to my gum, the further I would drive it. He said, I couldn't do it. I said, well, John, you were dumb in the first place to try to think you could fill your own tooth.
You're darn right.
But this, I think the needle is probably one of the greatest fear factors that people have had in getting some dental treatments done, because some people have severe periodontal problems. If you have to go really deep below the gum, it's very painful, and some of those people need injections so that can be done. Is that correct?
They do, and even now in Florida now, hygienists can give those injections. So you don't necessarily...
Wait a minute, you have a dental tech that can give injections?
Yeah, both of my hygienists give injections now. So it's no longer limited to the dentist, but there is a specific technique that, if followed, can minimize the pain. And of course, I've taught my associates that technique, and I've taught my hygienists that technique as well. And I can teach it to you too. You ready?
Ready.
All right, good. So the first thing we want to do is understand that there are 2 different kinds of pain in the injection. One is the puncture of the needle itself. It's sounding horrible, isn't it?
Not really, because I know I've had you do it to me, so that's why I want you. That's why I ask a question. You tell them.
All right, good. So one is the puncture of the needle itself, and the second is the pressure of the fluid that's going in to the tissue. Notice what I'm doing. I'm doing this. So here's the key element. The first thing is the puncture. Of course, the needles are very, very sharp and very small these days.
Right.
So the first thing we do is just go underneath the tissue with the needle and just inject for 1 second. That's it. A little bit of, just a drop of fluid in the area where the injection is going in. Take the needle out and let that area, wait about 2 minutes, and that little area, that little site where the needle went in will now get numb. Now you can inject through that site and you won't feel the puncture anymore because it's already numb. And now you express the fluid very, very slowly. And that eliminates that pressure phenomenon that you feel. As long as you're injecting slowly, that means that the tissue has time to absorb the fluid. And we can get rid of the second portion of that. The most painful injection in the mouth is the palatal injection, the injection that goes into the palate, because there the tissue is very tightly bound down and can't accept the fluid. We just do that technique a little bit more slowly, and that can be a painless injection as well.
I'm thinking about those shots as you describe them.
Yeah.
Because I've had the palate shots, and one of the things I know that bothers my wife is she doesn't like anybody touch her face. And when the dentist did that wiggle technique, and I asked you about it on the radio show, tell the viewers why dentists squeeze your jaw or they massage the gum. Why do you do that?
Understand that all of us, and I'm talking about all of us in the dental profession, are sensitive to the reputation that we have. We're trying to do everything we can to make that experience good. And the reputation, of course, goes back from a long time ago when either we had uncaring dentists or unknowledgeable dentists, and as far as injection technique went. And so we've always been looking for techniques that would help. One technique is the one that you talk about, where you wiggle the jaw, you massage the gum, you do something like that. And the idea, it's a distraction technique. So if you're concentrating on this, if you're feeling this, then you don't feel the needle going in. That's the reason for that. I tend to use this other technique, which I've found to be very successful over the years, worked very, very well. And it's working very well for many doctors.
We talk about the changes in the drills, the changes in your office. You have a CT scan that you can do the whole mouth at one time, and it goes down real deep, and you can really tell. That's where you really get to the root of the periodontal problem, is when you can really see below the gums.
I'll tell you, there are things that the reason for the CT scan primarily was dental implants. That because dental implants are being placed in a 3-dimensional location where we need to make sure it's okay this way and it's okay this way. The only way you can do that properly is to do that with the CT scan. Understand, at the beginning of my career, or beginning of my dental implant placement career, which will be 30 years ago in May, we didn't have CT scans available. You know what we did? We had a panoramic x-ray. We took a panoramic x-ray. That's the one that goes around your head.
Yeah.
I get the film. I put a piece of tracing paper on top of that. I drew in the size of the implant. I had a plastic template that told me what the correct size was, understanding that I could not see the thickness of the bone, which is the most important thing. The way we measure the thickness of the bone is that I would squeeze my fingers around the tissue. We would have some estimates as to how thick the tissue was, and then we would infer that in fact this was the correct size of the bone. We really didn't know until we made the incision. Contrast that to where we are today. We take a CT scan. I get a virtual model of the jaw. I can actually do virtual surgery on the computer before I ever do it in your mouth. I know exactly what I'm going to do. I can even have a surgical guide made in advance if I need to. So I just snap that surgical guide over the teeth. It has a little sleeve that'll direct me right in the correct trajectory in exactly the same place that I designed that implant when I did the computer model. And it just makes things a lot faster, a lot easier.
What you're describing, what Dr. Sheldon is describing, in my opinion, and he's going to either concur or correct me, what I'm saying to you as a viewer is that you can go to a veterinarian and have an appendectomy if you want to do that. You can go to almost anybody and get something done if it's not their specialty, and it might work out. But it's doubtful that a veterinarian could do a successful appendectomy. So I would prefer to go to a surgeon that does that.
Yeah.
The same thing in the practice of dentistry. What we fail to understand at times, Lee, is that I think a lot of people fail to understand. They think that when you say dentist, we think filling, or we think tooth extraction. We don't think about what happens when we take a tooth out or two teeth out. And when they start moving, it changes the teeth over here, it changes the bite, it changes everything. And if you don't have a dentist on top of that that understands what's happening and what you can do to prevent some of that, we end up with bigger problems that we really want to admit. And sometimes I've been tempted just to call you and say, I want to come over and I want you to check my bite just with the litmus stuff to see what my teeth are doing.
Yeah.
And because I'm attuned to how my jaw feels if it doesn't feel right. So I think all the things we're talking about dental techniques, we talk about CT scans, we talk about painless injection. And then we also want to talk about something that's changed over the years, and this is the way dentists set their office up. You have been, in my opinion, you've been very smart, because what Dr. Sheldon has done, folks, is he's got a TV in his waiting room where people sit and wait. And he takes all these TV shows that he's filmed with me over the years, and he puts those things where people coming in can see all these different things. And I suspect you might put some other shows on you think are very good for people to see. But it it informs people about what you think about what you're doing. When they can hear somebody talk about what they're doing to people's mouth, it's because you mentioned something about bone. It's because of wars, Vietnam and Korea, that we've learned that there are a lot of ways to talk about. We talk about grafting skin. Yeah. You graft bone.
Sure.
And you can make bone grow.
And tissue as well. We can grow new tissue. If the old tissue is somehow absent, we can graft new tissue in as well as new bone.
But with this new dental experience, Lee, there are a lot of people that have dentures. They've got dentures that work. They might not be completely happy with them, but those people who have those dentures that slip and the gum doesn't hold them in, they could come to you or people that do implant surgery, and they could have a couple of implants, but I think it takes 2 for uppers and 4 for lowers, or
the other way around, 2 for the lowers and 4 for the uppers.
Oh, because it's harder to hold the uppers in.
It is, yeah.
But if you have teeth in and you can't eat corn or you can't eat sticky things because you're worried about your teeth coming out, why not go to a dentist that does implant surgery and get 4, or at least put implants in uppers or lowers so that they work?
Yeah, that can be done. And I'll tell you the most important part, and I don't want to gloss by that, is that diagnosis and treatment planning is as important, if not more important, than treatment. Example, if you built a house and you went to the contractor and said, build me a house, and the contractor said, well, where are the plans? You'd have to go back, and what would you do? You'd have to go to an architect and make sure you have plans. The architectural design of what we do, and I don't want to magnify this into too much, but at the same time, the design of what we do makes the treatment go that much faster and that much more predictably. And predictability is what we're looking for. And so when we're talking about dental implant therapy, periodontal treatment, dental treatment in and of itself, there should be a plan in mind that I have or that we have as dentists, and that the patient can understand, so that we know what the sequence of events is going to be, what the risks and the rewards are going to be, and what the costs are going to be.
Okay. But there's one other, we're almost out of time. There's one thing I just still want to talk about. Okay. Because I started talking about with the TV in your office. what you have done, and I think I see other dentists doing it, they worry more about what we call the tone level in their office.
Exactly right.
What does the office atmosphere project to the patient? Is it in an office that you just go in and you got a clerk at the desk that you can pay your copay to, and a stack of magazines? Or is it an experience that sort of radiates out where people can sort of sense what the dentists are doing? And I think that makes successful dentists that take the fear factor away from people. It sort of separates them from just the average dentist.
I think you're right, because and it's a big concern. And Danielle, my office manager, who you know, she is the keeper of the tone level in the office. If the tone level is working well, then everybody's happy, and that means staff is happy, and ultimately, and doctors are happy, and patients are happy. And every once in a while, somebody's going to have a bad day. And if somebody has a bad day, we don't want that bad day to bring down everybody's tone level. So if that person is having a bad day, good, we talk to that person, make sure that person's bad day is not interfering with the office. That tone level goes back up, and the entire tone level becomes a high tone level, and that's what you want. You want patients to be happy to be there, and particularly with the work we do, and our work is fairly intense. We want them to have a good experience. They have to have a good experience in order to be able to make sure they're getting through this comfortably, predictably, and want to come back for treatment.
Yeah. Regardless of what kind of experience you're going to have, if the experience is a positive one, you walk away happier than you would if it was a negative experience.
Absolutely right.
As a periodontist, you got 12 seconds. What do you tell our viewers? Just one quick comment.
If there's a complex situation and you're not feeling that you have it well under control, go see a periodontist by yourself and get a good examination and treatment plan done.
That's a good advice. And viewer, I want to thank you for watching today's episode of Helping Seniors. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.